reporting the most cases, and 50 countries are reporting increasing cases over the last week, 4 from the central, 4 from the eastern, and 5 from the western region. So most of, let's say like 1, 2, 3, 4, 5, 6 countries in the southern regions are on the warning level of 4, which is red. It means a very widespread or fast-growing outbreak. So lastly, this is in terms of testing. In terms of the testing, total COVID tests conducted in Africa, over 34.8 million tests has been conducted so far, and 8.9 tests per reported cases, and 11.3% positivity rate. But the percentage increase since last week is 15% for testing. I think that's all from me. Thank you for your attention. Over to you, Ezini.
Okay, that was very brief. Thank you very much, Chika. Are there any questions? Let me look at the chat. Any questions, comments, additions for the presentation Chika has given us? Our region is really a hotspot, right from the first wave and has continued into the second wave. We have more people putting their details on the chat box. So welcome to the Mozambique team. Thank you for joining us today. And we also have Botswana. Thank you for joining us as well. So you can see from what she indicated, our region is quite hot. So if there are no comments, additions, questions to this, we can move into the topic for today. And I want to introduce Dr. Sofonias Tesema. He is with Africa CDC headquarters. I think I'll let him introduce himself and then be able to also introduce the discussion today. Our topic, like we saw when we shared the invitation, is genomic sequencing with respect to COVID-19 response, looking at the Africa Genomic Consortium initiative, what roles that has to play in the COVID-19 response. So over to you, Dr. Sofonias, for your introduction as well as introduction of the topic for today. Let me enable you to share your screen.
Thank you, Ezini.
You can try sharing your screen now.
Can you see my screen?
Yes.
Thank you, Ezini, for the opportunity to introduce and present the progress that we've made so far as part of the Africa Pathogen Genomics Initiative. My name is Sofonias Tesema, working here at the Africa CDC headquarters as an implementation expert for pathogen genomics and bioinformatics under the Division of Laboratory Systems and Networks. Today, I'll take you through what we've done so far and what challenge we faced and our next steps in expanding genomic surveillance in the continent. This may not be that important to this audience, but public health pathogen genomics has been revolutionizing public health across the globe by improving precision in the detection of outbreaks, investigations, and responses, improving sensitivity of detecting new variants, vaccine escape variants, new mutations, drug resistance mutations, and the like. It improves efficiency. Some assays, old school assays that will take days to get the results, can now easily be sequenced, and the genetic materials can be seen, and we can identify change mutations very quickly. And it's very critical in the discovery of novel threats. For example, the discovery of SARS-CoV-2 virus was enabled by pathogen genomics, by sequencing. When people showed this, the pneumonia symptom, the samples were sequenced and the virus was discovered. So these are some of the added values of having public health pathogen genomics. So owing to the advantage and the added value of pathogen genomics, Africa CDC has been working on this area for the last 2 years. The first thing that Africa CDC did is trying to understand what are the challenges of implementing this technology in public health settings in Africa. Our assessment found that we did a continental assessment, some on site, others in virtual assessments. Our finding shows that more than 80% of sequencing capacity in Africa is not in public health institutions. Majority of it is in academic institutions or research institutions. So this shows the critical gap in pathogen genomics implementation across Africa for public health purposes. Other challenges that we've seen are lack of continental policies and guidance to support and guide the implementation of pathogen genomics, limited capacity, both in the lab as well as in the bioinformatics, inadequate, well-trained technical workforce, and there is also limited translation of public health genomics for public health decision-making. I would like to stress here, it doesn't really mean that we don't have success stories. There are good success stories across a range of pathogens, from Ebola to Lassa fever, and even now with SARS-CoV-2, despite all these limitations and challenges. So to respond to this challenge and address this challenge effectively, Africa CDC launched the Institute of Pathogen Genomics in last year with a vision to integrate pathogen genomics and bioinformatics into public health surveillance, outbreak investigations, and improved disease control and prevention across the continent. The Institute was given 5 cross-cutting priorities. One is to create enabling mechanisms, policies and guidelines. 2 is to really support the establishment of a continental pathogen genomics and bioinformatics network, strengthen capacity building, not only just in the lab, but on the bioinformatics workforce, as well as developing a data system that works for the continent, and conducting implementation of high priority public health use cases. With these priorities, we've been working on, but while after the institution was established, there was the SARS-CoV-2 outbreak early last year. So we've been focusing on supporting the genomic surveillance of SARS-CoV-2 in the continent. As you all know, public health genomic surveillance for SARS-CoV-2 is important in understanding the emergence and geographic spread of new variants, what kind of variants, what kind of lineages are circulating across the continent, to monitor new mutations that can have impact on clinical outcome, diagnostics and therapeutics, and also understanding new mutations that can evade or affect vaccinations. Since the beginning of March 2020, Africa CDC, together with partners, have supported equipment and reagents to 16 laboratories. 3 are still pending. Trainings and technical supports were conducted. Series of trainings, series of webinars were conducted with support from the private sector, the public health, the public sector, as well as the philanthropic sector. In September 2020, together with the World Health Organization, WHO Afro, we established the Africa CDC WHO COVID-19 sequencing network. This network has 3 layers. The top ones, we call them specialized genomics and bioinformatics centers. ASEGID in Nigeria, SANBI, a bioinformatics institution in South Africa, CRISP, again in South Africa. These are the 3 specialized centers. that are tasked to support the continent in sequencing and sequence analysis. Below that, we have 11 regional labs in all the 5 regions. So you can see we have labs in the northern, western, central, east, and Southern Africa. So NICD and CRISP are the 2 institutions that are supporting sequencing activities in Southern Africa. So our effort in strengthening SARS-CoV-2 sequencing has grown into a more continental and bigger initiative that we launched in October 2020, which we call the Africa Pathogen Genomics Initiative. This initiative is supported by the Bill and Melinda Gates Foundation, Illumina, Oxford Nanopore Technology, US CDC, Microsoft, and several other partners. So what is this Africa Pathogen Genomics Initiative? The Africa Pathogen Genomics Initiative is drawn from what I showed you earlier, some of the challenges that we identified in our assessment. We identified 5 challenges, and the initiative is working towards addressing all these 5 challenges. The first one is challenges that are related to enabling mechanisms, policies, and guidelines. So strengthening Africa CDC's capacity and the Institute of Pathogen Genomics capacity is critical in addressing the continental challenges that are related to policies and guidelines, creating coordination mechanisms, as well as mobilizing resources to support pathogen genomics. The second one is establishing the African Pathogen Genomics and Bioinformatics Network. This is very critical for public health because as part of this initiative, we are planning to strengthen sequencing capacity in at least 20 national public health institutions across the continent. This number is still low compared to the gap in the need in the continent, but we believe this will help us address some of the severe challenges that we have in Africa. The third is creating data and data architecture system. This is very critical because pathogen genomic data is sensitive. So we would like to have a more secure and trusted data system that gives the control power for the national public health institutes. The fourth priority is the NGS Academy, where workforce development is prioritized. There are several challenges that are related to genomic workforce, bioinformatic workforce, as well as a workforce that can analyze, translate, and interpret genomic data into meaningful public health informations. So the NGS Academy is focusing on working towards addressing some of these challenges that are related to workforce development. At the moment, 2 institutions in Africa are tasked to develop a framework, a training framework, and a training curriculum for pathogen genomics and bioinformatics that we can use to train public health officials, decision makers across the continent. The fifth is the implementation of high impact genomic use cases. These are the priority areas of the initiative. So what this initiative is doing in addressing the challenges that are related to the new SARS-CoV-2 variants. As of 25 February, there are more than 8,000 genomes across 29 countries in Africa. However, majority of these sequences are generated from South Africa. As you can see on this map, the size of the bubble shows the number of sequences that are already shared. You can see many countries still have limited sequence outputs or sequences that are already sequenced and shared with the global community. Since the report of these new variants, the 3 new variants, the B117, which was first reported from the UK, the B1351, which was first reported from South Africa, and the P1 variant, which was first reported from Brazil. We are tracking the distribution of these variants in Africa, as well as we are supporting the sequencing of more samples, as well as increasing the geographic representations of sampling in the continent to address and understand the distribution of these variants in the continent. So I'm just gonna skip this. These are the 3 variants of concern that we are closely monitoring in Africa, and they have their own very defining and different mutations that have some impact on transmission, clinical outcome, as well as vaccine efficacy. As of 25 February, again, there are 10 countries that are reporting these mutations. As you know, South Africa first reported this, the B1351 mutation. Later on, it's reported from Mozambique, Botswana, Zambia, and other countries in the East and Central Africa have also reported this, this variant. Whereas in the Western Africa, we see the B117 to be more dominant. B117 is so far reported from 76 sequences in Nigeria, 67 sequences in Ghana, and 3 sequences in Gambia. DRC, Kenya, South Africa have also reported this variant. As you can see in the previous maps, we have very limited genomic data to really determine the distribution of these variants across the continent. Considering the impact of these mutations on transmission, on clinical outcome, vaccine efficacy, more data is needed, more representation is needed, and routine genomic surveillance is critical. So to support this, the genomic surveillance of the new variants, Africa CDC developed an acceleration plan where we plan to accelerate SARS-CoV-2 sequencing in the continent. The acceleration plan is driven from, one is to effectively operationalize the network that I showed you, to increase our coordination capacity, to leverage on existing genomic capacity in the continent, and to really make sure that countries have access to sequencing facilities. So again, I'm showing this same network that we developed in collaboration with WHO Afro. As you can see, almost every country can have access to sequencing facilities either in the regional labs or in the specialized centers. So with a focus on Southern Africa, you can see countries in the Southern Africa can have a sequencing service either from NICD or CRISP if they don't have local sequencing capacity. So in our acceleration plan, what does that mean, and how does that help in terms of accelerating SARS-CoV-2 sequencing and in terms of providing sequencing services to countries that do not have well-developed sequencing facilities? So one is, as part of this acceleration plan, we are mobilizing and we are leveraging the existing capacity. These mobilized resources are actually being directed to support sequencing facilities in terms of addressing personnel challenges, in terms of addressing reagents and equipments, and the like. We are also supporting sample collection and shipment. Basically, we have created a system where countries can actually submit requests for sequencing, and our logistic officers will follow and take care of the logistic activities. We are also supporting the regional labs with sequencing reagents. In some cases, we are also supporting equipment upgrades, and all regional labs are sub-awarded with some grant to support personnel and address some of these challenges. Africa CDC, together with the regional labs and the specialized centers, we also support data analysis, sharing, and interpretation. So what progress have we made in some of these these activities with a focus on Southern Africa? This is a summary of, as of yesterday, some countries: Namibia, Lesotho, Eswatini. The samples, to my knowledge, the samples are sequenced and the results are sent back to the labs. With CRISP in Southern Africa, again, Mozambique have sent 3 rounds of samples. This is what we really encourage in order to get a really good picture of what is going on and what kind of variants are circulating. We need routine sequencing of samples every week or every other week. With that, it can give us, how the variants are evolving, whether new variants are introduced, or whether these variants are expanding and dominating the circulating SARS-CoV-2 variants. So we really encourage countries to have continued surveillance, routine surveillance of even the number of samples is smaller. If it is meant to be representative, I think it can give us a very good picture.
And of that which was in the ground. He was our example. He was brought down, but he was quickened by this.
Hello?
Apologies, someone was unmuted. I've muted the person. Sorry, you can continue, Dr. Sophonias.
Okay, thank you. So in terms of sample selection, what we really encourage is at least 200 samples, 50 samples per week sent every month to the sequencing lab, to the sequencing laboratories with full detailed metadata. We would also recommend that SARS-CoV-2 samples should be representative. Here is not the number of samples that are sequenced. I think I can give an example here. South Africa have sequenced maybe about 3,500 samples. The UK sequenced hundreds of thousands of samples. But both countries were able to pick new variants. Probably the South African team picked the first variant. What is really important is representativeness and routineness of the surveillance. So we really recommend to have routine surveillance. We are supporting these labs, the regional labs, to support sequencing of samples for routine sampling. Therefore, we ask countries to send samples to these labs routinely and get really good data that can inform the outbreak response, as well as decisions that are related to vaccines and other things. Representativeness can be key here. Representativeness with age groups, representativeness with geographic locations within the country, representing the different parts of the country. Different time points. We recommend samples to be distributed across different time points. And ideally, samples can also be representative of different, representing the different spectrums of the disease, asymptomatic, symptomatic, hospitalized patients as well. So if we are able to do even a few number of up to 50 samples per week, 200 samples per month, but if we do it routinely in a more representative way, it can actually give us really good picture of what kind of variants are circulating and where. So this is really critical in getting an effective genomic surveillance in place. So in order to support this, the Africa CDC has a sequencing request submission system. Any country can submit a request in this form, and the request immediately will be processed, and the requesting country will be notified about the procedures in sending the samples and where to send the samples. So as you can see, we have a contact person here, dorcasw@africaunion.org, can actually give you all the detailed information when it comes to the logistics of shipping samples from the countries to the sequencing labs, and also following up on mechanisms to get the results quickly. So while we're trying to establish this network of labs, we have challenges. Some of the challenges are the lack of standardized sampling framework. We are working on this to really develop a guidance, a practical guidance. It will be released soon. We also are facing challenges in terms of market and custom issues, available sequencing equipment. Globally is limited at the moment. There is a very high competition. So we are trying to work with the partners, work with the private sectors to address these issues. The third is material transfer agreements between the countries that are sending specimens and the receiving labs. Sometimes the material transfer agreement process can take a few days and in some cases weeks. The fourth point that we are trying to address is standardizing the data analysis, because we believe once the samples are sent to these labs, we would like the data to be analyzed in a standardized fashion and shared and reported to the countries in a more meaningful way. So we are working with bioinformatics partners in addressing the challenges that are related to data analysis. So in summary, accelerating SARS-CoV-2 genomic surveillance is needed. We need timely and sharing, which will help us to determine the geographic spread of the reported variants, as well as to really continue and monitor the emergence of new variants. Therefore, on behalf of all the Africa PGI personnel, I really request to use this system, to use these regional facilities to support our genomic surveillance of COVID-19. The most important message that I have for today is genomic surveillance can only be useful if it is routinely done. It's not about the number of samples, it's about the representativeness of the samples. If we are able to send representative samples every week or every other week to the sequencing labs, and if we get those results quickly, I think it will really help in addressing some of the challenges that are related to the variants and to monitor the emergence of new variants in the future as well. This is what I have for today, and thank you very much. I'm happy to take any questions.
Thank you very much, Dr. Stefanes. This is a lot, and I believe there are questions. So let's just dive into the questions. If you have any questions, please put in the chat function, or you can raise your hand, and we can call on you to ask your question. You can tell me after this amazing presentation, there are no questions. Okay, there is a question. As most countries enter vaccine season, how important will be genetic sequencing in the choice of vaccine selection? This is from Simba Chiwanda, Zimbabwe. Nelia has a hand up, so maybe we can take 3 questions at once and then he can ask. So Nelia, you can ask your question. You can unmute yourself and ask your question.
Thank you very much, Esme, and everyone on the call. I just wanted to thank the presenter for the wonderful presentation that they've done. But I wanted to find out of the genomic sequencing that has been done so far. Are there any new variants that have been identified, or is it still the 3 main variants that we've been dealing with in Africa? That is the South African and the Nigerian variant. Are those the only 2 that are troubling us at the moment, or are there any new discoveries? Thank you.
Okay, is there a 3rd question so that we can take it as a batch? Maybe you can bring down your hand now. Okay, great. So there are none. So there are 2 questions for you, Dr. Stefanes, looking at how important genetic sequencing will be in the choice of vaccine for a country. And then the second question, apart from the variants that were discovered in South Africa and Nigeria, are there other ones that have been discovered on the continent? Over to you, Dr. Stefanes.
Thank you so much for these 2 really very important questions. So the first one, as we go into the vaccine season, as you know, the vaccine rollout is slower in the continent. So understanding what variants are circulating in which country is very important. This is why we've been trying to prioritize the Southern African region, but also in the Western African region where these new variants are circulating. Understanding the proportions, the frequency of these variants is important in making decisions when it comes to vaccine policy for some countries. And the second one is, even after rollout of vaccines, monitoring whether new variants are arrived or whether new variants are emerged is important in the control of this outbreak. As you know, even if the number of cases are decreasing across the continent, but there are still, the transmission is ongoing. The longer the transmission is ongoing, it's a chance for the virus to mutate. So these mutations, all mutations may not have an impact, but some mutations are critically important. So continued genomic surveillance, even after the rollout of vaccines, until we get to 0 COVID cases, is very important in monitoring the emergence of new variants, which may have an impact, which may escape vaccines. So genomic surveillance is critical even before or after the vaccine rollout. The second question, at the moment we are monitoring the 3 variants. These 3 new variants are the B1351, which was first reported from South Africa, the B117 reported from UK, and the P1 from Brazil. So far, we only have the B117 and the B1351 reported from the continent. But at the same time, we are in discussion with the labs, the bioinformatics personnel, to keep an eye on new mutations, new lineages, new variants that are seen in the continent. Because when a new variant emerges, it doesn't emerge with very high frequency. It emerges with very low frequency. So the detection of that requires very standardized data analysis, and it requires very detailed look into the architecture of the genome of the virus. So we know there are a couple of lineages. I don't know if you are aware of some of the lineages. That there's the C11 lineage that was reported from some African countries. So we are keeping an eye on those variants and to see whether that actually has any impact on transmission, whether that's actually replacing other variants or not. So at the moment, although we are tracking only the 3 new variants, we are working with the labs to keep an eye on any new mutations or any new changes in the genome of the virus. Over to you.
Thanks, Dr. Sophonias. There are more questions. Okay, there's an appreciation, very insightful presentation on genomic sequencing. Thank you, Doctor. Comments and appreciations are welcome. Thank you very much. Then also we have Nicole Walter from South Africa says, thank you for the great talk. As mentioned, there is a need to increase bioinformatics capacity in Africa. Are there any plans for bioinformatics analysis trainings so that genomic data can be analyzed for public health application? Dr. Sophonias, any capacity building you want to cite?
Yeah. Sorry. Thanks, Nicole. Yes, the bioinformatics training is critical. And I think I didn't go into the detail of trainings that we are planning to do. We are working with H3 Bionet, with Professor Nicola Mulder's group in South Africa, with CRISP in South Africa, Professor Christian Happy in Egypt, and other bioinformaticians across the continent to develop what exactly should be our training look like. What are the methods that we need to train people on? Because the public health pathogen genomics space is still developing. There is a public health alliance for genomic epidemiology, which is also based in South Africa. We are engaging with all these partners in terms of defining the framework for training. Moving forward and thinking beyond COVID. What are the kind of trainings that are needed for public health pathogen genomics and public health bioinformatics? But in short-term trainings, we are working with partners. We just had 2-3 weeks ago, we had a training on genomics and bioinformatics for 8 African countries. And we are also planning a new training focusing on the bioinformatics tools that are available from some of the suppliers. We will have additional trainings if COVID allows, face-to-face training for both genomics and bioinformatics, one to be coordinated in the Southern Africa region. So we are continuing to have training plans, but for the long term, what we are trying to address is really answering the question: what should be the training framework look like? What are the curriculums that we would like to use in terms of training bioinformaticians for public health purposes? So this is our focus area, but we are also doing, mentorships. If there are needs in terms of bioinformatics mentorship, we'll be able to link the bioinformaticians with bioinformaticians in other countries, in other labs, to work together and get the mentorship, the training and mentorship opportunity as well. So in short term, we try to address the immediate need, but for the long term, what we would really like to have is a well-defined curricula for pathogen bioinformatics, pathogen genomics for the continent in public health settings. That is the most critical thing that we are focusing on. Over to you.
Thank you very much. So in case anybody wants to do next steps from this presentation, your country is interested in mentorships and all that, you can write to the RCC at the email I've put there. That is our official RCC email, Africa CDC RCC South, and we can take it up and direct you accordingly. So if there are no other questions, I think we can draw the curtain on the presentation today, unless we can give like 30 seconds in case anybody else has anything else to say. But in the meantime, are there people from Lesotho and Eswatini on the call? Kindly just indicate in the chats if you're from Eswatini or Lesotho, while we give 30 seconds for any other questions. Okay, it seems everyone is happy with the presentation. And if that's the case, I just have a few comments to make before I hand over to the regional coordinator to give us the closing remarks and a wrap up for today. So as we know, those of us who have been with the ECHO platform since inception, that is from 2017, we usually have yearly plans, proposed topics, and it's not just Africa CDC coming to talk to you, it's also supposed to be a platform for information sharing between member states. So for COVID, we've used the platform a lot for information sharing from Africa CDC, telling you about initiatives, helping to coordinate responses and our activities in countries. But we need to also get back to the regional plan for the community of practice, which is information sharing amongst member states, sharing of best practices. So our next ECHO is going to be tailored towards arriving at a plan for the year where we can alternate from which member states presenting on different things, anything that has to do with IHR competencies. That was the original plan of the ECHO session. So this is me saying that the next session we're going to, please, we need you on board to be able to, because we cannot just create a list and give to the member states. The member states have to come together to come up with these presentations, because you are the ones who are going to give the presentation so that your colleagues from other countries can learn from what you're doing best in your country. That is the point of the information sharing community of practice. So if this is your first time on the call, please leave your email address in the chat box so that subsequent ECHO sessions, you'll get an invitation, because we send emails ahead of time with the topic and the link to our mailing list. So if this is your first time joining us, I oblige you to kindly put your email address in the chat box. The person from Lesotho, kindly put your email address in the chat box. Also, if you can provide more of your details in the chat box, kindly do so. So that is all from me, and I hope that next 2 weeks we've had almost 40 participants today for this interesting conversation. I will share the link, the recording, with everyone. And Dr. Sophanias, if you could kindly share this presentation with me so that I can share with the team, because they are already asking for the presentation. Is that okay with you, Dr. Sophanias?
Yes, sure. I'll send you the presentation.
Thank you very much. So please, your emails in the chat box and join us in 2 weeks' time. When I send the email for the next 2 weeks and for the proposed agenda, proposed plans for the year, if you have suggestions, can you reply to the email? We'll get them so that when we come to the session next 2 weeks, we'll be prepared to really just have a final draft by the end of the ECHO session. So I would hand over now to the regional coordinator, Dr. Lu, for his closing remarks, and we can wrap up for today. Over to you, Dr. Lu.
Thank you. Thank you, Izzy, and also I seize the opportunity. So I also would like to seize this opportunity to thank all the participants who are on the call, my colleagues and ladies and gentlemen. I think I would like to express my great satisfaction for the manner in which these meetings of ECHO since I joined the RCC have been very, very important, and they involve in discussing health issues of the extreme importance and also of great interest to the healthcare workers in these regions and also to the people that we are serving in the region and perhaps in the whole continent. Again, regarding the issues being discussed, as Izzy put it correctly, I think we need to encourage the countries to lead from France, come up with some of the issues of the interest in their own country that we can be able to include. If I can recall, for those of you who had an opportunity, I believe 3 weeks or 4 weeks ago, we had the ECHO meeting in which the Republic of Zimbabwe, they had the opportunity of presenting the role of the community healthcare workers. They describe it as a game changer, as the best practices in terms of how to respond to COVID-19 tracking of the cases and surveillance. And I think this is what we really need from each country. We need to see what is the best practices, the roles that is being done in countries that has made a big difference, as that has changed the games in responding to the ongoing COVID-19. Also, before I end my remarks, I would like to give my sincere gratitude to all of you, and also to my colleagues at the RCC, and especially also our colleague, Sophanis, for very, very informative presentations, and also for the guidance that you have provided. I'm very, very pleased and hopeful that the member state, they took notes of some of the opportunities that are happening, and concerning the progress that made by the Republic of Zambia. I had opportunity also to be in this meeting. They make a lot of progress in sequencing of the COVID-19 virus. And it's something also that I recommended to the African CDC leadership to consider documenting the practices of the Zambia that can be also presented and shared with other countries in terms of the COVID-19 sequences. So also I would like to inform you and also to invite you, especially those who are working in COVID-19 vaccines. I think this season is the most important season for all of us. At least we can see the light at the end of the tunnel. The vaccine for COVID-19 is coming. But there are so many challenges that need to be addressed so we can get the maximum benefit of the available vaccine that will be available in our continent. So this Friday, African Unions, Africa CDC, ECOSOC, African Development Banks, they will launch series of COVID-19. That will start this Friday, Friday 5th March 2021, It will run through the month of the May. The inaugural meeting, which will take place on Friday, Dr. John, the director of the African CDC, will have an opportunity to provide useful opening remarks. And those remarks will be on Africa's CDC COVID-19 vaccine strategy and how African CDC will do and is doing to help countries roll out the vaccines, COVID-19 vaccines successfully, addressing some of the challenges that will emerge. So I would like to encourage all of you to invite all the technical experts in countries who are involved in vaccine to participate in that meeting. It will will shed a lot of light on how the African CDC, through its platform and also through its partnership with the COVAX facility, addressing the gaps and the challenges regarding the COVID-19. So I will ask my colleagues to to share those links, and I will also encourage you to share them with your colleagues. So with this, I want to thank all of you who are called for the great leadership, for the effective contribution and participation, and for those issues that have been raised. Glad our colleagues, Dr. Sofanis, have strategically outlined the support that is available for the member states who are still experiencing some gaps. And with this, I would like to remind all of you that with our institution, the Africa CDC stands on its commitments to work and support all the member states in Southern Africa continents and in the whole continent. So we ask you to seize this opportunity to take advantage of all those available support for those who are in the countries who are still battling the burden of the second wave of COVID-19, who are still also need some additional support from the Africa CDC. I encourage you to submit those needs in writings through the email address that was shared and provided. So the Africa CDC will have a reason to look into what you need and can take an action in supporting you. So with this, thank you. And I wish all of you a very beautiful afternoon. Thank you, over to you.
Thank you very much, Dr. Lu, for a very comprehensive wrap to a very beautiful session, and a very good afternoon, and have a lovely day to everybody. Stay safe.
Thank you. Bye-bye.
Bye.
Bye.
Thank you. Bye.
Bye-bye.
Bye-bye.